HMPV, otherwise known as the Human Metapneumovirus, is a type of virus that affects the respiratory system and is also a common cause of respiratory infections, particularly in children and older adults. Now, HMPV was first identified in 2001 and has since been recognized as a significant cause of respiratory illness worldwide. HMPV is mostly associated with mild upper respiratory tract symptoms such as a cough, a sore throat, runny nose, headache, and possibly fever. But to help us unpack, what this is and also understand who is at risk, we're joined virtually now by medical researcher, Professor Tulio de Oliveira, as well as Technical Officer Emergency Preparedness at the World Health Organization Africa, Dr. Belinda Herring. Thanks so much, Prof. and Dr. Herring, to both of you for speaking to us here on Morning Live. And perhaps, Prof, if we could just start by talking about HPMV. What exactly is it? How long has it been around?
Okay, thank you. And first, good morning to all your viewers in South Africa. So as you highlight correctly, Human Metapneumovirus, or HMPV, has been discovered in 2001 by Dutch scientists. However, when one traces the origin of the virus has been circulating in the human population for over 200 years. That's the estimated date of introduction into the human population. What it means? It means that that's a common seasonal virus. It normally comes in the winter or in the late winter, and affect people around the world. In South Africa, every year we have infection of this virus. It is around the same time that you have influenza, a little bit after the RSV, that's another virus, And we have already some population immunity in South Africa. So it is a virus that causes normally acute respiratory infections, but is not considered to be a very dangerous virus, and is a virus that has been circulating for many decades around the world.
So after knowing what it exactly is, Professor de Oliveira, how does one get infected with HMPV? And also, is there a vaccine, or what is the treatment for it?
Okay, thank you. Thank you for that question. How one gets infected by HMPV is in the same way that one have infected by other respiratory viruses, such as flu or RSV. It is a respiratory transmitted virus. You can get infected direct from transmission. You have someone transmitted to the other one by respiratory, or by droplets that will fall and you may put your hand and put in your mouth. So it's the common way that other respiratory virus, it is transmitted, like COVID and flu. And is there a vaccine? And the answer is that no, there is not yet a vaccine. However, given that in the majority of the individuals, the symptoms are quite mild, it's just the common way to treat a cold or a light flu. Make sure that people is hydrated, that controlling fever is happen. And then also, if when it is with respiratory infection, to try to avoid attending big gatherings to continue the transmission.
So if I can bring you in here, Dr. Herring, we have been reading over the past few weeks and months about cases of HMPV being reported and climbing in China. So then we immediately start thinking back to COVID-19 and asking questions about whether we have an emergency response plan in place for an HMPV outbreak here on the African continent and in South Africa in particular.
So thank you for that question. And as Dr. Tulio said, it's a common sort of self-limiting infection. So it's not one of the respiratory viruses of great concern. It is of concern, though. And with the the number of cases climbing in China. Having a response plan is actually, a very good question. So since the COVID-19 pandemic, WHO AFRO has been working at updating pandemic preparedness and response plans in the region. And so we've been doing this, combining the lessons learnt from COVID and using a fairly broad approach so that the plan is applicable to any respiratory pathogen with pandemic or epidemic potential. So within South Africa, they were very quick off the mark and they have updated their preparedness and response plan for respiratory pathogens, and they engage with the experts and stakeholders regularly to review and test and update the plan.
And Dr. Herring, what is China saying about their situation at the moment, though? Because I think people are looking at that and there's great concern because people are worried. Nobody wants to go into another lockdown, which is perhaps one of the reasons why we're having this conversation, to allay some of those fears.
Yes. So what is happening in China is what they would normally see during winter. So they have a peak of influenza and other respiratory pathogens as RSV, and the number of infections of metapneumovirus is not unusual. They're also seeing mycoplasma pneumoniae. So they're seeing a lot of respiratory infections because it's winter, and particularly in the northern provinces of China. And they've reported that, their hospital systems are not overwhelmed, and this is nothing that is unusual. And that's data reported up until the end of last year.
Professor de Oliveira, you did mention in your previous response that people should avoid large gatherings again in order to avoid, more infections. But we know the Chinese New Year is coming up, and also one of the things that they have reported is seeing cases of children 14 years and younger also on the increase. So can we speak to those, and also again the South African context? What ought we be worried about here, if at all?
Okay, thank you. Yeah, so the first thing, just to be more precise, what I highlight is that one should avoid a large gathering if one has respiratory infection, and that's to avoid transmitting to other individuals. At the moment, there is no reason to want to avoid large gatherings, and we just had a big one in the festive season in South Africa, especially if one is healthy, and that's what you do during that season. You socialize, you see family, you see friends, you see colleagues. So there is no need to avoid that unless you are sick, which is always a good idea. It's basic common sense, yeah. And so, and what's going to happen now, what we expect to happen in the next 2 weeks, is that the case will start decreasing in the northern hemisphere. There is signals that both the outbreaks of respiratory infections, for example, in China, and also in the United Kingdom, they also have a very big flu season, what they call. It's hitting the peak and should start coming down. For South Africa, there is no reason to concern at the moment. Yeah, we have seen this viral for decades, and we are also in our summer months. What may happen in South Africa is that normally around beginning of February, we start our RSV wave, and that's normally associated with children going back to school. And then, and for the ones that have young children, I have 3 children, and I remember every year when they are young, I get like a cold as they go back to school. It is, again, just to use common sense. If your child starts developing a respiratory infection, try to avoid send to school if you can, and treat the symptoms. So there is nothing too concerning South Africa. And another suggestion for your viewers, it is the ones with advanced age and comorbidity to think about having the flu vaccination before our winter wave that starts normally in June, July.
And then, Dr. Herring, where can the public go for more information and, this in order to try and avoid misinformation and avoid unnecessary panic?
So the WHO has just published what they call a disease outbreak news, and that's available on the WHO site. Other information on human metapneumovirus can be found on the CDC website. They have a good description of HMPV and its symptoms, signs and symptoms, treatment, and also the American Lung Association have a very good website.
So I think this has been very instructive in just helping us understand this HMPV virus, what it is, and of course, as both of you have indicated, no need to panic at this stage, or it's something that's been with us for a long time, and I think it's just very important given how the narrative has been coming through as if it was something that we need to worry about again. But let me just give each of you a quick moment just to give us your final thoughts, and again just what the public needs to know about HMPV, starting with Professor de Oliveira.
Okay, thank you. As Dr. Belinda highlighted, South Africa has a very advanced surveillance system, and we are really on top of that, In addition of the resource that she highlighted, the WHO, both the NICD, also have a whole resource about HMPV. We also have released a resource in our website, SERI and CRISP websites, and we are engaging on communicating in a very scientific, factual way about this virus that do not have to cause any kind of panic, And then to the South Africans, we just go back, to our normal life. Everyone's starting working and school, and the main advice is just common sense about respiratory infections, and preparing for the winter wave with vaccination for the ones in need.
Dr. Herring?
I would concur with Professor Oliveira. It sort of comments with the places that you can find the information. NICD in South Africa has an extremely robust surveillance system, which involves GPs and hospitals and clinics across South Africa. So infections will be picked up, and also concurring with the public health and social measures of, wearing masks if you're sick and staying at home, and doing all those kinds of things, and disposing of tissues if you have a cold in the bin, and coughing into your elbow and not into the environment. So I think as Professor Oliveira said, common sense around respiratory infections, and we'll be good.
Well, thank you so much to both of you this morning, just, helping us understand what it is that we are dealing with. Director of the Centre for Epidemic Response and Innovation, Professor Tulio de Oliveira, as well as WHO Africa's Technical Officer, Emergency Preparedness, Dr. Belinda Herring, and debunking for us this latest phenomenon. Well, not latest, as they said, it's been around for a long time, HPMV, and no need to panic.